idea how something else comes up. And like, yes, teaching school, LVN school, that just sparked my feet. Like, oh wow, I need to go back to school. I want to go back to school because educating them make me want to further my education. And so, yeah. So, but you can't end up in pitfalls. People get caught up now. I see in the new medical, the new nursing is about money. People want to jump from job to job to job, trying to get the higher pay, and it's. Yeah, you're never going to get, like, the business work. You're never going to get those huge bonuses. You're never going to do all that. It's nursing. But if you keep jumping up, you miss it. You'll miss your career. Your career is a bunch of resumes, but you don't have longevity. And so I see that. I see that sometimes people come to a company just for the money. And then, oh, the money's not there. Oh, I'm going to another company. So, yeah. So it's sometimes you get high turnover.
What are your communication strengths and your communication weaknesses?
My communication strength is, some people tell me I'm like a mother. And so my team, I make sure they have this. I try to communicate with them. Whatever I know, I make sure they know. And if I in services, one-on-one talking, group talking, or I believe sometime in a notebook, here, this communicating this to you, just so you're aware. We send emails. And the other pitfall is because I'm a person who my hands move, but I don't like to write. So my weaknesses is writing it down so you'll know exactly what I know. And that's what my boss always says. He says, you're excellent, you're the most, you can multitask like nobody else, but you just don't like to stop and write. So, but that's why I constantly talk, because I'm constantly telling them, this and this and that. And I may do, a little writing here, but to sit down, because I do, like some people tell me, you do have a good business mind. If you would just sit down and write a business plan, you would have businesses. But you just don't like to write. But no one will know what you know, because you know so much, because you're constantly trying to learn. I'm all about learning. You always have to stay humble in anything you do, so you can always be open to learn something new from anyone. Like if you're someone on the street, learn something new. You always set yourself to learn something, because we don't know everything. But if I go and learn something, I'll tell you about it. Okay, I'll write it later. I'll write that later. One of these days I'm gonna write it down though. I'm gonna have my own business, because people keep speaking that to me. You know enough about hospital, open your own. You know enough about this, you need to open your own. I said, okay. But the other thing is you have to believe in yourself. You have to okay, I can do that. Or just myself, it's like, I don't want to be bothered with all the business part of it. But it'll happen. It'll happen.
Have you had any cultural competency training to assist you in working with treating individuals from other backgrounds, like dealing with different cultural healthcare beliefs, treatment preferences, and other options?
Yes. We have a culture diversity training, because in hospice as well as in healthcare, and I worked at children's hospitals, and even when I came here to Houston, I worked at Texas Children, which is a global for kids. So we got Lebanese children, we got children from Russia, we got African children. So you have to respect their culture, whatever their ritual is. Respect it. In hospice, we do the same. If we have someone who is Buddhism and they want us after the time of death leave the body and stay for 8 hours, we respect that. We leave it there, and so that they can do their ceremonies and stuff. So we do the culture diversity training. Yeah.
What are the challenges of effectively communicating with patients or other healthcare professionals from a different culture or background?
The challenges for it? The challenge is if you don't speak the language. Because I speak English and I have broken little Spanish. And so I make it fun. And we have phone interpreters. Then they speak the multiple language. You just get them on and we do a 3-way conversation. Or if there is someone at the home, I try to do just basic. I try not to do the medical part, because I don't want them caught in the middle trying to explain, the dying process. If that's not them, so I want them to stay with the family. So what we do is then we use the phone, or we take a person out with us that speaks that language to the home and stuff. But my broken Spanish, I can do signs and point here and da da da. and this have fun with, but yeah, but some races you couldn't. You just need to be, because of the way they are. It's like if you don't make eye contact, on some cultures they find it disrespectful.
Mm-hmm.
Others, if you make eye contact, they call that disrespect because you're beneath them, so you need to be looking below them. Mm-hmm. So yeah, we do that kind of training. Know that.
Okay. How do you handle language barriers? Well, you already answered. Do you use an interpreter? Are you learning a second language? So, are you learning a second language?
Yeah, I took Spanish. And when I try to speak it, they tell me I sound like I'm Asian because it's just like not coming there. But yeah, I'm gonna want to take another one. I'm gonna try to do a recording and kind of just listen to it.
For Spanish?
Spanish, yeah. Okay. Yeah, Spanish. And I've known German because my dad was military, so we did German, but when we came back here to America, nobody was speaking German, so kind of lost that.
Okay. Are brochures, pamphlets, or other materials provided in another language? Is anything lost in translation?
Oh yeah, no, we have things in Spanish, and we can print out for any different languages. But a lot of our clientele that come to us, a lot of them, even they're from Russia or from various countries, they speak English. But we go ahead and offer and let them know, if you need something written in your language, we can. But the majority of the time, for Spanish people, we have everything written in Spanish, mm-hmm. English and Spanish.
Mm-hmm. Okay. Does gender play a role in how you communicate or how others communicate to you while on the job?
No.
No?
No, I have men and women.
Okay. Does age have an impact on the job communication?
No, because when I was a home team manager, a lot of my home health aides were older than me. So even when I became a manager, a charge nurse in San Antonio Pediatric ICU, mm-hmm. a lot of the LVNs who were there were older than me, and they had worked there because I was born at the hospital I worked at. So 5 of those nurses worked on the floor the time that I was born at that hospital. So they said, one of us hit your butt. I was like, wow. Because it's like, wow, I'm your charge nurse, and these are nurses who were here when I was born here. So, mm-hmm. So to me, that was honor. So no, age doesn't matter.
Okay. What role do nonverbal communication cues play in your work environment? How did you learn to interpret the nonverbal communication cues?
We have training. We use for smiley faces, and we have what we call the behavioral observation. So when a nurse goes in, if the patient's unresponsive, we look at the cues on their face. Are they frowning? Are they moaning? Or when you turn them, they flinch because they can't speak. So we use that, or we'll tell them, which face, if they can't talk, if they have cancer of the throat or something, point to which face they, rating their pain. Because mm-hmm. pain is a big thing in hospice. Yeah, so we're trained in that.
And the smiley faces are the ones that are on the
card.
Yeah.
Yeah.
Do you have any final thoughts or advice to give me?
Final thoughts. Well, if you chose nursing for your career, you'll be very good. Because you seem like you have a very caring heart, mm-hmm. and that, and you have to have compassion for people, and then even for your coworkers, because the thing is, they may be working beside you, but we all have personal lives, and you never know when something is really getting to someone. Because in hospitals, we watch out for each other, because you may walk in as a 38-year-old female who is the same age as you and dying of cancer and have a child, and you have a child at home, so. As a manager, I kind of try to watch for that and support them, and if I need to switch up an assignment or something like that. So you always want to watch for your team. Mm-hmm. If you're going to be a part of the team, you have to, be very sensitive to and compassionate to your team. That we're all here to do a job, but we're also here to support each other and stuff. And you have to do that even if you're in business, you're in banking. You still want to, you want to watch and have a caring heart mm-hmm. for everyone around you. Now, granted, there's going to be some that. Sometimes you're like, wow. Then you're like, okay, I need more compassion, I need more patience. But the thing is again, sometimes people act out, and you really got a lot of personal stuff going on at home. Mm-hmm. Some people don't know how to separate the two. People bring their baggage. Mm-hmm. So you just, try to do the best you can to help them, work with their problems within and say, okay, we're all here to help you, but I can't solve all of your problems.
Mm-hmm.
Because some do. They expect us to solve all of the problems. And it's like, no, but no, that's my thing. But I love nursing. I've always loved nursing.
Okay.
Yeah.
Well, thank you for letting me interview you.
You're welcome.
And thank you for being a great interviewee.
Okay, well, thank you.